We seek all this insight and understanding about our relationships and how we can be more effective to be able to change them. So let's take a moment and reflect on what are the developmental opportunities here to help individuals, relationships, and whole healthcare organizations, and at some point the entire system, provide the kind of healing and caring that we hope we'll find there when we go into a hospital. Well, one of them, of course, as I alluded to, has to be focused on your sustainability. That each one of you, in whatever your role, doctor, nurse, staff person, taking a person's insurance information, an administrator, processing billing, everybody focuses on the patients, as they should. And if we do it well, we focus on the quality of the interactions and relationships, so they're not just instrumental, or here's the form, go fill it out and wait. But they're caring. But we also have to worry about ourselves. That if we can't sustain ourselves, we are going to have diminishing returns and then, in fact, increasing problems. And the problems will be interpersonal at first, and then they'll become medical. So one of the things we have to think about is, how do we sustain these activities? How do we renew ourselves? And that's where the research suggests you can learn this. And you probably used to do parts of it. Some of you may be doing it now. You look like a fairly fit group, but there are other things that people have done, have had as habits, and then you let slip by. So whether we're encouraging activities that help you become more mindful, like meditation or yoga or prayer, physical exercise, or it's engaging in some sense of realistic hope or optimism about the future, but within the bounds of what's feasible, exercising gratitude and compassion, caring for each other, and if the situation feels appropriate, a degree of playfulness. That those are the activities that we can learn about, those are the activities we can think about, and those are the activities we can practice more of. A second major developmental opportunity has to do with empathy, because the use of the social intelligence competencies and the state of mind and of heart, the presence that is fed by your emotional intelligence competencies, all come down to a critical discernment moment, a critical moment of tuning into the other person. And we know from research like John Dissetti's neurological research that you can do it through yourself, almost a projection form of empathy that comes more out of parts of the medial prefrontal cortex, or you can do it through a genuine opening yourself up to the other person, which he says comes from more of the posterior cingulate cortex. That it is the latter form of empathy which comes across to the other person as genuine caring. And that's what we're after. That's what we're after in our relationships with each other at work, and that's what we're after in the patient care relationships. Again, that can be developed. More likely, you wouldn't have gotten into this field unless you had a lot of it to begin with. What we're wrestling with, and certainly any of us over 45 know, that the toll of all of this chronic stress and all this sacrifice leads to a certain loss of awareness, loss of the activities, in between taking our daughter to her tennis lesson and getting the storm door fixed and planning a family vacation and polishing off another 50 emails. We forget. We forget to do the very things we need to do. And that's when training, coaching, and help comes into play. Because that leads to the third activity, which really is the enabling one for the first two. You need a regular checkup. Look, you tell your patients all the time that they need to come in for a physical, and periodically, as you age, and there are stage-related things, you have to come in more frequently for fairly intrusive, embarrassing procedures. But all of that comes down to the real nature of preventative health, of maintenance, of well-being, of wellness programs, is to do things before the problems emerge. So we recommend that you seriously consider a minimum of an annual leadership checkup. How am I doing in my relationships? How is it going? And you know full well that you can't do this by yourself. You need to bring people in, and whether it's colleagues and peers or other of the human resource staff or coaching staff in your company, or it could be outsiders, people that are brought in to help that. But whatever it is, make sure you have your regular checkups.